Well, here we see the trend in the United States back from March, what we could call the first wave. Never really went away, so this is more a continuation, these increases of the first wave. We could call it a second wave if you want. We are tending to call it a second wave in Europe now, but they're the increasing cases in the United States that we are seeing now. Now, to be fair, the testing here now is better than the testing was back in July. So these numbers here were probably actually somewhat higher than these ones. But the point is the trend is up as we go into fall, autumn time. And I believe there's something going on today in the United States. So I hope you have a good and peaceful day for your election. So moving on from the United States, the United Kingdom, and we see the sharp increase. Now we know these numbers were grossly underestimated by about a factor of 50, but nevertheless the sharp increase there is quite unmistakable in the United Kingdom. Canada, which we're going to look at it in a little more detail today, again, Canada doing very well over the summer, but there's no question about the increasing trend there. Now the numbers aren't that high still for Canada, but the direction is upwards, which is really the concern. It's the direction. Now I forgot to put the country on here, but this is Australia. No community transmission at the moment. There are the odd cases, but they're imported cases and they're quarantined. So that is what the graph is supposed to look like. The cases dropping away there to essentially no new cases. So well done, Australia. France, sort of European pattern really, I'm afraid, increasing cases. Russia, well, quite a dramatic increase in Russia. Again, the weather really deteriorating now in Russia, making indoor life essential really, because it gets pretty cold there. And again, I forgot to put the numbers on here, but this is Belgium, and again we see the underdiagnosed first wave, but the great increase in cases there. And we know that Belgium actually has the highest new cases per capita. Poland, again, not a good trajectory. Very, very sharp increase there in Poland. So you are welcome to this video, as always, of course. So I just thought that was some interesting background to begin with. Now, I'm not going to comment too much on the United States today, because basically I'm going to leave you to it. There will be things to say later in the week about the United States. But let's look at Canada now. Now, most countries have dashboards and ways of communicating. And if you've got a PhD in disease spread or something like that, or you're some infectious disease expert, then the European Centre for Disease Control website's pretty good. For the rest of us, it's pretty difficult to understand. The American one's quite good. You don't need to be an expert epidemiologist to understand the American one. But I think the best one, actually, for intelligibility and sheer volume of useful information is the Canadian one. It really is a very, very well-run website. So let's have a quick look. Good to see there's no cases in Nunavut. Now, there's not a lot of people live there, of course, but the people that do live there are mostly Indigenous Canadians, so they have a higher risk. So it's good to see that there's no actual cases been reported there, so that's good news. Now, Yukon, very few cases, but they have increased lately, as you see from the graph. So the graphs over here that we're looking at. Northwest Territories, again, a few new cases. British Columbia, again, we see the line steepening up as we go to, I can't do both at the same time, but we see the line steepening up, unfortunately, on the graphic over there. Alberta, likewise. Saskatchewan, very sharp increase there in Manitoba. That is an unmistakable trend there as we head into autumn, fall time, Ontario. Quebec has got by far the highest number of cases so far. And then New Brunswick, Newfoundland and Labrador. So very useful data there in Canada, and you can change it to all sorts of other things if you want to, and it is all live data. Now, the other thing that the Canadian site does is it's got a really good whole world kind of review. So let's have a quick look at that while we're here. It is a bit addictive, this. It's so much interesting stuff on it. But all you do is scroll down from this one, and there it is there. And we get the international map. And again, you can have total cases, deaths, cases in the last 14 days, whatever you want there. Let's go for cases in the last 14 days per 100,000 of the population. And we see where the increases are. Now, as we've seen, quite a big increase in Russia. But look at Africa here. This is just such good news. 0 to 6.5 new cases per 100,000 of the population in many African countries. We might look a bit at Kenya as well. We will look a bit at Kenya later on. Does seem to have been a bit of an increase in Kenya there. Africa's still a bit of an unknown. South Africa, of course, many more cases, but it seems to have gone down quite dramatically. Argentina, constant rise. Brazil, we know the cases are greatly underreported, but it does seem to have been a reduction. The United States, recent increase. Canada also, we see a recent increase. So I'm not going to spend any more time on that now. There's so many things you could look at, but I've given you the link there. Well worth going into that website. Fascinating to have a look at it. Now, moving on to content for today. So that's where I got the daily cases from, World Meter. That's the official Canadian site. Just click on that link. Now, I'm constantly being asked questions about the difference between COVID-19, influenza and pneumonia. Now, COVID-19, of course, we know is a viral infection. Influenza is a viral infection. Most cases this time of year caused by influenza A, but a completely different type of virus. They don't have any cross immunity. And if you have COVID-19, you can get influenza at the same time, which has got a poor prognosis from the data that we have. Pneumonia just means pneumonia is infection in the lung tissue. So down in the lungs, we have these air sacs, these alveoli, where the oxygen goes, where the air goes and the oxygen goes into the blood and the carbon dioxide goes back. Billions, I guess, of these microscopic air sacs. If you open them all out for the whole surface area in your young, fit lungs, it's round about 100 square metres of internal surface area, all in this few litres capacity of the thoracic cavity. Quite an amazing fractile infolding. But pneumonia is infection at the level of these alveoli. Now, it can be bacterial, it can be viral. Very often, if it's viral pneumonia, bacterial pneumonia can complicate that. So we're dealing with three different things. But the thing I'm always asked is, get many comments on, that COVID-19 is no worse than normal flu, than normal influenza. So let's look at that and see what the data is actually saying to answer this question. And I think you probably know what the answer is already, actually, but it's worth looking at with data. So coronavirus, influenza and pneumonia. This is direct from the British government site. Data just released today, in fact. Now, deaths January and August, January to August, that should be, January to August 2020. Now, deaths caused by COVID-19 in that period of time, 48,168 deaths. And these were people that died within 28 days of diagnosis. Caused by pneumonia, 13,619. Now, this is not vaguely surprising, because pneumonia is a remarkably common cause of death, and many people who have a long-term condition can get pneumonia, and that can be the last straw, if you like, that breaks the camel's back, that causes the death. And if you talk to your grandmother's generation, some of them might remember the saying that pneumonia can be the old person's friend, that people can be suffering, perhaps with a cancer, pneumonia comes along and that takes their suffering away. So pneumonia is often present at death anyway. And if you take someone young and fit like you and you put you to bed for 6 weeks, you'll probably get pneumonia anyway, just from the immobility. It's quite feasible. So pneumonia, very common, not at all surprising. We see it all the time, and we always in A&E departments are getting people in with respiratory sepsis, as we tend to call it now. But deaths caused by influenza, 394, according to death certificate data, where influenza was identified as the cause of death. So COVID, 48,000, influenza directly, 394. Pneumonia, which can be a complication of that one and can be a complication of that one, or can just be caused by a variety of other infections. That kind of number is not remotely surprising. So COVID-19 is clearly more dangerous than influenza. That is what the figures say. Highest number of deaths due to influenza and pneumonia was in January 2020. And again, that's not surprising. December, January are the times where you get most patients in with influenza typically. But deaths from influenza and pneumonia this season, that is the 2019-2020 season, have been well below average. Very low numbers of cases. And I think, or relatively low numbers of cases, I think we can see some data on that. Hopefully. Yes. So here we have some figures on that from the British government statistics. So this is number of people, this is males, this is females. So influenza, very low numbers of deaths, thankfully. Pneumonia, total number. And of course the height of that column is that column in addition to that column there, because that's male deaths and that's female deaths from pneumonia. Again, not at all surprising, what we would expect. COVID-19, well, total numbers, males, females. Compare the columns there to the columns here on the linear scale, and that shows us how much more deadly COVID-19 is compared to influenza. And here we have the graphs, influenza and pneumonia 5-year average, and influenza and pneumonia. So what we see here is January, February, March, April, May, June, July and August. All throughout these times, the amount of influenza and pneumonia deaths was below the 5-year average. But then of course we see the COVID deaths dwarfing them when there was a lot of COVID deaths. This is the column of COVID deaths here. Thankfully the deaths have been low lately. But this is the potential death rate that we do worry about with COVID-19. So I think that is a fairly definitive answer to that question, and hopefully we won't need to return to that for a while. COVID-19, January to August, deaths have been higher than those caused by influenza and pneumonia, 1959 to 2020. So what this is saying, if I can get my technology sorted out, what this is saying is that the Office for National Statistics started collecting detailed data in 1959. So all the time they've got detailed data from 1959 to 2000, COVID deaths this year have exceeded influenza deaths in any of those years. Now, having said that, in 1957, there was a really severe outbreak of influenza in 1957, and we don't have the detailed numbers from that, but it was a severe outbreak. But I suspect we've lost more people due to COVID this year than we lost to influenza even in 1957. But 1959 to 2020, all the years we have data, it's been a more deadly COVID year. I think I'll just tell you a brief story, actually. I don't know why, but you probably don't want to know. But in 1957, the end of 1957, the winter of 1957 to 1958, my mum and dad had this 1957 influenza and were too sick to look after me. And my gran had to come and take me away when I was 6 months old, and I was with her for about a fortnight until my mum recovered enough. So very, very severe outbreak in 1957. I didn't seem to get it, but I'm sure you wanted to know that. Not very much, but never mind. Sorry about that. Now, moving on to the current pandemic again, I'm going to tell you about one man's experience. Now, whether someone chooses to disclose their experience of sickness is a very personalised decision. And many people have chosen to share their experiences with me, and I've made a lot of videos and things about people's experience with diabetes and things like that are on the website. And I always find it a very noble thing for people to share their suffering and pain. Because like me, you've had severe suffering, and you've had, well, at the time it's felt like to me pretty severe pain I've had, and talking about it can be difficult. It induces a lot of emotions. But here's one man's experience, who was recently given an interview to one of the newspapers in my country. Doctors prepared to announce his death. This man is called Boris Johnson, and he's the Prime Minister of my country, and he's just given this information. Now he says this: "They gave me a face mask, so I got litres and litres of oxygen. For a long time I had that and the little nose jobbie." Right, I'll just translate I think Mr. Johnson is talking about here. So basically, if you have a nasal cannula, we call them nasal specs, nasal speculum, we can give oxygen at 22 or 24%. So 2 litres per minute, nasal cannula, 2 litres of oxygen, pretty well 22%. 4 litres through a nasal cannula, pretty well 24%. That's the way we do it. If you want higher concentrations of oxygen, like 28, 48, 50, higher concentrations of oxygen, we need the whole mask. So it tells me that the Prime Minister needed higher concentrations of oxygen to maintain his saturations. That tells me without the oxygen he may well have died. Really quite simple. It was a tough old moment, I won't deny it. So absolutely. The bloody indicators kept going in the wrong direction. Now here he's talking as an individual citizen, not as a Prime Minister. But I think what he means is his oxygen saturations kept going down, his indicators. Probably his heart rate kept going up, probably his fever kept going up, maybe his blood pressure was going down. His white cell count would be going up, maybe his serum lactate was going up, or indeed his white cells might have been dramatically going down. But the indicators kept going in the wrong direction. And this was, when was this? This was early April. I think it was about the 4th of April he was admitted, something like that. So treatments then weren't anything like as good as they are now. And he realised there was no cure for COVID-19. And of course, this is still very much the case. We don't have a specific antiviral treatment. He went on to say, and these are all direct quotes, by the way, because I put them in italics. "It was hard to believe that in just a few days my health had deteriorated to this extent." And this is always true. When you have health, you take it for granted. You can't imagine losing it. And yet we all will. We all will lose our health. We all will die. But that's hard to conceptualise when you're feeling well. But this was the case in the Prime Minister's case. "I remember feeling frustrated. I couldn't understand why I wasn't getting better." Again, very, very often we've had minor illnesses and we get better. But then one day we'll get an illness that we don't get better from very quickly. One day, unless we die traumatically, we'll get an illness we don't get better from at all. So a very human experience here. I can really relate to this myself, and with thousands of people that I've talked to. Well, hundreds of people that I've talked to anyway. It probably is thousands, actually. Probably will be thousands. But the bad moment came when it was 50-50, when they were going to have to put a tube down my windpipe. In other words, they may have needed to intubate the Prime Minister. This is putting an endotracheal tube down into the trachea, inflating it, Patients have to be sedated, they need muscle relaxation. It's quite a difficult process, and we know that a lot of people that are intubated and ventilated don't get better. But fortunately he didn't need that. Then he said, that's when I got a bit. Then he lost his train of thought, not surprisingly, because it's a remarkably emotional thing to describe. They were starting to think about how to handle it presentationally. In other words, how would they announce the death of a Prime Minister? So I appreciate Mr. Johnson sharing that with us. It's whether you're the Prime Minister or not, it's not an easy thing. And we just learned today that Prince William had COVID-19 about the same time as his dad, and decided not to announce it because that would have meant the heir to the throne and the next in line to the throne would have both been sick at the same time. So he decided not to reveal that he had it. And of course, whether someone reveals whether they have any illness or not is entirely personal choice. But that was the choice he made at that time. Let's just have a slight distraction here. So this is sent in by Genevieve, and she's bought one of these pulse oximeters, and I don't see any reason why most of us shouldn't have one of these in the house. But I am slightly concerned about Genevieve because her heart rate is 99. Okay, we can live with that. But her oxygen saturations are 0. Now that is lower than the 94 to 98% we would like. And of course, I think you probably realise why our oxygen saturations are 0. I won't say answers on a postcard, it's pretty obvious. So what to do is if people are wearing nail varnish. So if I add now, let's just try it. So here's my, I'll just turn my machine on. See how I'm doing today. I was a bit tachycardic, but heart rate was a bit fast yesterday. A bit more relaxed today. Come on. Doesn't want to work. If it doesn't work, turn it off and turn it on again and see what you get that time. There we go. So my heart rate today is 87 and my oxygen saturations are 99. Heart rate 85, oxygen saturations 97. And of course, if I had nail varnish on, I may well have oxygen saturations of 0. So if you've got a patient with nail varnish on, no problem, just turn it by 90 degrees like that. So it's on sideways, like that, and it still works. So heart rate 86, oxygen saturations 98. And that is with my finger in that way. Of course, you can use that finger as well. So if you've got nail varnish on, don't put it in that way. Put it in sideways. Now, you can get those for a pretty good price, so there's no reason not to have one in. So thanks, Geraldine, for that. It's a very good illustration of nail varnish that can cause unnecessary anxiety if you're not aware of the problem. Actually, our fingers are nice and pink, so I think it's unlikely there's an oxygen saturation of 0 anyway, but that is another indicator. Right, just some brief information now, also from the UK. I think illustrates some useful principles. Public Health England reporting. So the reporting on week 44 report up to week. So this data is actually for week 43 up to the 29th of October. No, so reported on the 29th of October. Get this right. About the week of the 19th to the 25th of October. That's the week. So that's week 43. So that's the week it's reporting on. COVID-19 at a national level has continued to increase, unfortunately, we know. Current limited testing for other respiratory viruses. So there's lots of respiratory viruses and we're only testing for a few of those. So there's a bit of an unknown there. But influenza we are quite good at testing for, and so far there's been one positive case diagnosed by laboratory confirmation in the UK this influenza season. One case. And it's called an AH3 type. These letters denote the H anyway denotes the type of protein on the surface of the virus. It's a type of influenza strain. So one diagnosed case of influenza, officially diagnosed, this is in England actually, England and Wales. I think it's Wales as well. So one case. So far we don't really have an influenza season. Let's hope that keeps up. Cases are very low in the United States. Cases have been very low in Australia. So somewhat optimistic about this influenza season, although it is too early to tell, of course. We tends to get worse in December, January is the worst time for influenza. But I am really hopeful that with all the precautions that are being taken for COVID, that's going to stop influenza spreading as well. Now, rhinovirus activity is high, but decreased over the past few weeks. Now, the common cold, coryza, can be caused by rhinoviruses most commonly, and it can also be caused by the other 4 types of less pathogenic coronaviruses. Most cases of the common cold, though, are caused by rhinoviruses, so this tells us the amount of colds in the country, common cold, is decreasing. Increase and positive rates of COVID-19, though. So in other words, there's increase in cases and there's increase in positivity rates in the north of England. So there's more cases, and the percentage of people tested per 100, the percentage of those coming back positive is also increasing, indicating community spread. Highest rate still in 20 to 29-year-olds, but this is encouraging. 10 to 19-year-olds decreasing cases. This is despite schools being back for the last few months, so that is encouraging. I think it's still too early to make any conclusions about that as to whether we should be temporarily closing schools again during the forthcoming month lockdown that's about to happen, but that data trend is unmistakably good. Now, this data trend is not positivity rates were highest in the over 80s. So the positivity rates, as we've said, for every 100 tests that are done in over 80s, in this case, the amount of positive tests are coming back greater. I don't know what it is. I think it's about 4% at the moment. But of course, these are the patients that are most likely to suffer severe illness and death. Linear. It's actually a logarithmic increasing likelihood of death with age. So that is concerning. COVID-19 hospital and intensive care admissions continue to increase, as we know. COVID-19 deaths have increased. So COVID-19 deaths have increased. And remember, this is in the period from the 19th to the 25th of October. So the deaths during that time from COVID have increased. But there's no overall excess in deaths. So the COVID-19 deaths plus all the other deaths is not higher than we would expect for the 5-year average, which is encouraging. The northwest, the Liverpool, Manchester area is an exception to that. There has been some increase in overall deaths. National seroprevalence in blood sample donors is about 5.6%. I think I worked that out at about 3 million people for England and Wales, 3 and a bit million people. So it looks like about 3.2 million people have had COVID-19 in the past few months, because we know the antibodies only last for about 3 months. So, just over 3 million people have had COVID-19 in the last few months, according to that antibody surveillance seroprevalence data. The rates of seroprevalence are highest in London, indicating there's probably been most infections in London over the past few months, and also highest in young adults, indicating there's been more infections in young adults over the past 3 months as well. But we knew that anyway, because that's where a lot of the disease spread has come from. Influenza vaccine uptake is the highest it has ever been. We are on a record year for influenza vaccine. Another reason why I'm optimistic about we're having a good flu season, unless there's some really, really transmissible pathogenic influenza A type virus. I'm optimistic about the flu season because vaccination rates are so high, and general precautions that prevent the spread of respiratory viruses, of course, are in place for COVID-19. Anyway, people over age 65 and between 2 and 3 year olds also have very high rates of vaccine uptake, which is good. highest ever, as do at-risk groups such as frontline workers. Right, now I'm going to show you some pictures from Geraldine from Kenya. And I think we'll start off with the bad news. This is the bad news here. These are election. So the United States is not the only place with political activity going on. And you don't need me to comment on this crowd here. This is just... Okay, the only good thing going for it is it's outdoors, but mask wearing, limited. Must say I'm surprised. Kenya's been doing well in that respect. Bit of a recipe for a super spreader event there, I think. And we did see that cases in Kenya have been actually increasing lately. It's too early to say Africa's got away with this yet. So it seems like, I'm going to give you some things that Kenya's been doing brilliantly, but it seems when politics rears its head, people tend to become a little bit irrational sometimes. Judging from the Kenyan photographic, ethnographic evidence there anyway. Ethnographic photography, I guess. Right, Kenya. Ethnography just means studying people in context. I'm being a bit pretentious, sorry. Right, Kenya. Population 51 million. Cases, very few. Deaths, very few compared to the population. Looking good so far. Now, let's look at what they've been doing right. Hand sanitizers and soap are everywhere. Both of these will kill the virus. Excellent. They're in shops, they're in public areas, all over the place. Gloves are given out free in a lot of places. Masks are mandated, which is why I was surprised to see that at the election rally. Distancing is usually practiced, apart from when politics is involved there. Buses and minibuses are only half full, as are private cars, but the windows are always kept open. Ventilation is the key thing. All vehicles half occupancy. Curfew 7 p.m. to 5 a.m. and no groups no more than 5. And when I say this is enforced, the curfew is enforced from 7 p.m. to 5 a.m. What I mean by that is it is enforced. You would not want to be caught out at curfew time by the Kenyan police. Say no more, but you would not want to be in that position. Now, mentioning ventilation there, so many people have written into me and saying, but the building I work in, you can't open the windows. You know, we have gone from an architecture where you could open windows and it was on a human scale to architecture where you can't open the windows and it's not on a human scale. A lot of the architecture we have now, modern architecture, with plate glass windows, which are lovely today in the sun and you can feel quite nice in those buildings, but you can't open them. We have built many multi-million stroke billion dollar pound buildings that are very good at promoting the spread of respiratory infections. Unfortunately, this is almost an artifact of modern city life. I've given you the illustration before, but when I was young I used to work on Nightingale wards. Great big long wards, patients on both sides. Make the beds in the morning, open all the windows, lots of fresh air in, close the windows, let it warm up and then do the dressings after you've blown all the dust out. And we never had wound infections, virtually never. And you know, there were just much more hygienic places. Now in modern wards you can't open the windows. Or there might be one tiny window you can open just a little bit in case someone falls out of it. It's just... And this is in hospitals. How have we managed to knock down healthy hospital buildings and replace them with progressive, intrinsically unhealthy hospital buildings? Is it just me that finds that a bit strange? I suspect not. Anyway, getting back to Kenya. Only truck drivers allowed to travel from town to town. Now this is catching on. We know this has been successful in Australia, and actually in the UK now. The Welsh government has said they don't want anyone travelling from England to Wales during the English lockdown. And Nicola Sturgeon has said she doesn't want people travelling from England to Scotland either. It looks like the Welsh one's probably going to be enforced. The Scottish one, I'm not so sure. But that seems to be happening. Now, in Kenya as well, they have isolated areas for infected patients, which is a good idea, but there is a stigma attached to it, which is unfortunate. But Kenya's now starting to reopen, so what is going to happen? And we have seen that slight increase from the Canadian graphics about Kenya and other African countries. Now, I was very worried about them. Great to see that there's been very limited spread. I'm hoping there's not going to be much more spread because we're only a few months away from vaccines now. So, but I've put a few question marks there to illustrate my concern. Food distributed to poorer households who are isolating, excellent. Mount Kilimanjaro and Mount Kenya can both be seen from Nairobi. Wow. This means the pollution has cleared. Such good news. You can see both of those, and they're both at other ends of the country as far as I remember. But the air is cleared. The pollution is way less. We saw this in China. I mean, China's been back to normal for ages now, but you know, maybe this pandemic will make us think, well, would we like to see Kilimanjaro and Mount Kenya from Nairobi all the time? Yeah, because it means there's less atmospheric pollution. Now, good news. Waterborne diseases are down because of all the hygiene. The gastrointestinal, fecal, oral diseases are down. Road traffic accidents are down. And there's a lot of road traffic accidents in Kenya, dear me. An awful lot. Investment in healthcare is up, and they built their own good quality ventilator for $4,000. The ventilators we use in the UK and the United States don't cost $4,000. This one in Kenya does, and they've started Oxford vaccine trials. So sadly, very often in poorer countries who don't have a huge amount of foreign exchange, they don't get the best medical equipment. But this has motivated the Kenyan engineers, who are of course world class, to make their own. So that's good news. Now I think that's all about I wanted to say today. I'm just going to read you an email from something else. I might show you something else in a minute. This is about email from Taiwan. Watched your programme today, that's yesterday. Very pleased to see you talking about Taiwan response. I spent 6 months there between April and September and experienced the quarantine procedure upon arrival. Everything you said was true, but there are so many other things they did, including taking the political decisions out of the equation. All decisions and directions were made by the Taiwanese Centre for Disease Control. The leader of the Taiwanese Centre for Disease Control was on TV every day and people listened. He is now a national hero. Obviously. There's been no community spread there for 200 days, were that the case in your country and my country. The Tracing Act was created in days and anonymously tracked all phones. Anonymously tracked all phones. Now, I'm not saying people would accept that, but let me remind you, Taiwan has had no community transmission for 202 days. If your phone was traced to being close to a phone which was carried by someone who was positive, or near a phone that had been near to that person or other phones that had been close to that phone, then an SMS message was sent to all phones that had the potential for infection, advising the owners to isolate. There was no need to download apps. There was no need to turn on or off Bluetooth. So they started that straight away. We managed to get an app which still doesn't work brilliantly. It's only a few weeks ago, wasn't it? They built 90 plus manufacturing production lines in less than 2 months to ensure they were completely self-sufficient in masks and PPE, etc, etc, etc. A model of how to take charge and take care of your people and economy. no community transmission for 202 days. Now, some pictures I thought I might show you. I was in Kenya a few years ago. Let me just show you a few pictures. The video's finished now. You can stop if you want. This is us done. But there we go. So, yeah. In Kenya, you have to wear a tie if you're teaching, otherwise you've no credibility. So that looks like a bit of a brain. That'll be the cerebrum, that'll be the brainstem, that'll be the cerebellum. I imagine I'm about to draw a spinal cord. Can't remember what the lecture was about there, but the audience was very well behaved and very polite. So the teachers and faculty took the front rows, all the students were in the back. But they were very attentive, well behaved students. She taught in different parts of Kenya. This was the project to distribute my books. So these are books I wrote, and we were giving books out to students who'd never had new books before. So it was quite a moving experience. And there's some of the clinical and educational staff. Yeah. This is the compulsory picture every time you go somewhere in Kenya. All the kids come around. You don't have to stage it. They all just run to meet you. They just love the attention. This was giving out toothbrushes. Now, I hate these sort of pictures because, you know, nothing is worse than the idea of the white saviour, is it? But, you know, but the kids were just so happy to get toothbrushes that we thought, well, we'll do it anyway. But there you go. Okay. But the main thing is, I mean, I was teaching once in western part of Kenya, and the students won't let you go home. You know, you think, well, is it not tea time now? You know, just this. We actually did a study on the textbooks with the students from Kenya. We gave out these textbooks for a few hundred students, and we wanted to compare the way the textbooks were used in England, and there was another group in Cambodia, and another group, this group in Kenya. And the group in Kenya, I can't remember exactly, but in the first month of ownership, they spent something like 130 hours reading the textbook. It was unbelievable. In England, it was about an hour or two if you were lucky, and Cambodians were pretty good as well, but not as good as the Kenyans. They just spent so much time reading the books. It was really quite humbling data to process, and it showed that the same educational resource could be used in different situations, which was interesting. Okay, I'm prattling on now. My apologies. Do have a good day today if you're watching on the 3rd. It's now the late evening of the 2nd. Have a good and peaceful day if you're in the United States. And thank you for watching as always. You're always welcome.